Your immune system may be able to easily fight off COVID-19, but the person next to you could have immunodeficiency and they could die from COVID-19. Wearing a mask ensures the safety of not only yourself, but all others around you.
So, what is COVID-19? COVID-19 is an acute respiratory infection disease and is caused by a virus known as the SARS-CoV-2 virus. This virus causes flu and/or pneumonia-like symptoms and normally take 2 to 14 days after exposure to appear. These symptoms include, but are not limited to, difficulty breathing and shortness of breath, fever, dry cough, sore throat, and fatigue, according to the CDC.
According to the CDC, COVID-19 is primarily spread from person to person. This happens when an infected person talks, sneezes, or coughs, and the respiratory droplets are transmitted. This happens when the person is close, about 6 feet or 2 arms length. You can also become infected by touching a surface or an object that has a virus on it and then touching the mouth, nose, or eyes.
How do we prevent the spread? According to the CDC, effective ways to protect yourself and others includes washing hands often with soap and water for at least 20 seconds, using a hand sanitizer that contains at least 60% alcohol, limiting close contact with others. This includes abiding by the recommended social distancing measure of 6 feet, covering mouth and nose with a mask, and lastly, cleaning and disinfecting frequently touched surfaces daily.
Some masks are more effective than others. The N95 mask is the most effective, while the cloth covering mask is least effective.
Although the CDC requires the masses to wear masks, wearing a mask improperly is ineffective. Before putting on a mask, you should clean your hands with alcohol-based hand sanitizer or soap and water. When applying the mask, the color side of the mask should always face out and the adjustable nose strap should go over the bridge of your nose, covering your mouth and nose, and make sure there are no gaps between your face and mask. Avoid touching the mask while using it. If you do so, clean your hands with alcohol-based hand sanitizer or soap and water. Replace the mask with a new one as soon as it is damp and do not reuse single-use mask. To remove the mask, remove it from behind the ear, do not touch the front of the mask, and discard the mask immediately. After disposal of the mask, clean hands with alcohol-based hand sanitizer or soap and water.